Doctors say you can avoid the flu this season by taking one simple step, getting a flu shot. But the flu shot often gets a bad rap. And joining us now to dispel some common myths is Dr. Meredith Maxwell from Truro. Thanks so much for joining us.
Happy to be here.
Yes, well, first of all, a lot of people say if you're healthy, you don't need a flu shot. Is that true or false?
That is very incorrect. It is so much worse actually getting the flu. Think about all the kids and older people that you're around that could actually suffer severe effects if they do get the flu. So it's about protecting others as well as yourself. If you're in a house with small children, please get the flu shot. It's so important. Death can occur from the flu.
Yeah, so many people have said, I had the flu shot and I got sick. Is that true, or were you just going to get sick anyway and it didn't kick in time?
So you can't get the flu from the flu shot. You cannot. It is not possible. But it is possible that you were exposed to a virus before getting the flu shot or after. It does not protect against all viruses. For instance, the common cold, it does not protect against that. So you really need to go see your doctor and get checked. I know grandma and grandpa like to tell us that you get the flu, don't get it, but it's so important because there are so many deaths in this country that could be preventable from getting the flu shot.
Okay, what about pregnant women? Do they need special permission to get the flu shot, or is it okay for them?
No, it is so okay for pregnant women to get the flu shot. In fact, the baby is protected from the pregnant mother getting the flu shot. She can confer or transfer that immunity to her baby who cannot get a flu shot until 6 months. So that's really important, especially when you're pregnant, to get a flu shot.
All right, so it sort of paves the way for the baby to be healthier when it's born.
Exactly, and protects that baby.
Well, so the flu shot acts immediately. Is this true or false? Because
no.
Exactly.
That is so false, too. It takes about 2 weeks for you to develop antibodies to the flu. So it's really important to get it earlier in the season. Now, we think that there's mostly a bimodal peak, meaning it comes in 2 waves. It can start in October, but it could have a peak as far as April. So, you know, getting it now, it's not too late. It's really important that you get it. We can't predict when it's going to peak.
Now, this sounds ridiculous. Some people say, is it better to get the flu or the flu vaccine?
Definitely. The flu can kill you, especially if you have some very serious diseases. If you're young or older, it can hospitalize you. So definitely, you know, be proactive. Listen to your doctor. If you have questions, we would so be happy to answer any questions for you. But I think prevention is key. And
you hear people all the time ask you these questions, so if they sound like ridiculous questions, they're not. Because, and like you said, it's not too late. When's sort of the window when you need to get it for this season?
So we like to say October, but it's definitely not too late. You know, like I said, it can continue through April. Your insurance does cover a large portion, maybe even 100%. We really like to protect the community and prevent unnecessary illnesses, so it's never too late. So go out and get your flu shot today, especially because it takes 2 weeks to protect.
And you can even get it in some drugstores.
Exactly. If you don't have a primary care provider, you can get it from a Minute Clinic or like a Rite Aid or something like that. But if you have questions, definitely ask your doctor.
Dr. Meredith Maxwell says get your flu shot.
Yes,
all right, thanks
definitely.
so much. All right.